Good morning, everybody. It's a great pleasure and honor for me to be here and to be part of this very important conference. I want to recognize our guest of honor who is in our room. Happy to see you. And also take the opportunity to join the previous speakers in welcoming all of you to this conference. I also see my colleagues from Butabika Hospital. Nice to see you. I know we are always together, and I appreciate that you are always available to tackle this very important subject. I want to appreciate Africana for putting this up, and a special appreciation to Anne, who also invited me to be part of this and to make a presentation. Anne asked me to talk about drugs and their effects, especially the mental health effects. And I'll just do that because I'm told the time is really short. But before I do, I want just to us to remind ourselves about the importance of this meeting. This meeting, I'm very much aware, we are joining the international community in observing the International UN Day Against Drugs. This day falls on the 26th of June, and it has been running for many years, I think since 1987, when this day was first designated by the UN General Assembly. And the aim was really to continue mobilizing populations about drug abuse so that at the end of the day, we can probably have a drug-free world, which I believe we shall one day achieve. I'm glad that this is taking place. We may have missed it that day, but usually these activities continue through the year. And the important thing about this is to create awareness. So we are here to let you young people know that drugs do exist and that they are dangerous to use, and you are safer keeping away from them than beginning to take. And the reason we want to create awareness is because we get a lot of patients, a lot of young people in recovery who regret during the process of recovery and say they wish they knew they would never have started taking these substances, taking alcohol and all other things. So that goes to say that we need to pass the information on so that we don't get people regretting at the end of the day, saying they wish they knew they would never have taken that habit up. So let us take the day seriously as we create a bit of awareness. Now, I don't know about the visuals, but I think my slides should be up. And like I said, I should be quickly talking about these substances and their key effects. But just a quick reminder that when we talk about drugs, they fall in a group of conditions we call mental, neurological, about the mental, neurological, and substance use disorders. Now, these are part of what we call the non-communicable diseases. Non-communicable diseases are those that a person will acquire, not necessarily from a neighbor or a friend, but through other mechanisms that we shall see. Yeah, so I was talking about the mental, neurological, and substance use disorders, which are part of non-communicable diseases. And these diseases are on the increase currently globally. We have a lot of people suffering from these these three main conditions. And what is very common about these three is that one, all of them work on the brain. They affect, usually, I'm talking about the mental, neurological, and substance use disorders. They work on the brain, where they impair proper functioning of the brain. But the other thing is that much as they impact on the individual, they don't stop there. They also go to seriously affect wider communities. They affect family, they affect community, they affect society. Later we shall tell you that if you have one person in a family with addiction, that person will affect 7 other people. These could be family members, they could be relatives, they could be neighbors. Okay? But these diseases are also seriously stigmatized. There's a lot of stigma that goes with them, which we are struggling all the time to fight. And because of the stigma, sometimes people don't get the kind of treatment that is required. The other thing is that their recognition is low. People take long to realize that somebody is using drugs, or somebody has a mental health problem, or somebody maybe has epilepsy or some other condition. So those are common characteristics about them. Mental disorders are common, like I said before. They cause a lot of impact in people. They stop people from working well. They stop people from being productive. And they stop people from economically gaining and contributing to their countries. Globally, they say over 970 people do suffer these problems, with a prevalence of about 10-15% people suffering from various conditions, mental health conditions. In the country, I think people will be telling you about this. You've heard that a lot of us in the country do suffer the various mental health challenges, with a prevalence of about 14 million people in our country out of 46 suffering from various mental disorders, which is about 32% of the population, which is really quite high. And among the adults, about 24%, with depression being one of the commonest conditions. And depression, like we shall see later, and anxiety are also in a way precipitated by use of alcohol and drugs. Next. So for the drugs, really when we look at the drug situation globally, it's quite worrying. There are many people, because usually we use, there was the most recent World Drug Report, which indicated that the drugs or use of alcohol and drugs is on the increase. Currently, it's estimated that over 284 million people use drug in the year 2020. And unfortunately, for the young people, the majority of these people are young people. You know, they are young, lower age, from about 16 to about 35, constituting quite a large population of those, and particularly so in the African region. We are also seeing that the majority of people in treatment for drug abuse are people that are quite young, that shouldn't be in those places. They should be at school, they should be beginning work, but they are the ones that are facing the various challenges because of alcohol and drugs. And the report says that unfortunately, the young people these days, this particular period, are using drugs at a higher level than your colleagues who were young about 10 years ago. So it looks like your generation is beginning to pick up this vice more and more with more serious effects. Next. When we look at the country situation, it clearly depicts, it's also similar to what has been globally reported. In the country, we have heavy drug use. There are a lot of young people onto the drugs that we are seeing that are in treatment. When you compare evidence that we continue to get from hospitals, if you went to where my friends are working now, Butabika Hospital, there is an alcohol drug unit. The majority of people there are young, between the age of 16 to about probably 30. Very, very young. Just finished S4 or S6 or beginning university, but they've been weighed down by the drugs. But also some of the studies that have been done in schools also indicate a high prevalence of use of alcohol and drugs. So we have quite a wide range of drugs that people are using, and we shall look at these shortly. So I'm trying to rush because the time I'm given is really, really short. When we talk about drugs, a drug is any chemical substance that once taken into the body causes various changes within the body. We use drugs sometimes for treatment or prevention of disease, or sometimes diagnosis. But for today, the drugs we are talking about are those drugs that go, when you take them, go to work on the brain, and they cause various changes. Now, when they cause those changes, especially the changes that make people have to take the drugs repeatedly, those are the drugs that we are concerned about. So we call them drugs of addiction. They are called drugs of addiction because you take them one time or two times or three times, and thereafter you'll find that you have no control, but you are forced to continue taking them on a regular basis. So you get addicted. And addiction is, by definition, a process where a person is taken up by use of the drug, can never control how what to take and how much, but they are forced to take continuously and regularly and in a manner that begins to harm them. Okay? So the other question is, but why the addiction? How does addiction come about? Addiction comes about because these drugs have the capacity to change the way the brain functions, to change the chemistry within the brain, so that a person is forced to take continuously. Of course, there are other factors that cause a person to take these drugs on a regular basis. If we had time, we would look through this properly. Next. I want to go to the effects. Continue. We shall leave out all these. Next. Yeah, let's look at the common drugs. Sometimes we worry that when we tell young people about the drugs of addiction, they may start to use them. But it's important you know about some of these so that you take precaution, so that you are not, you get to know what is dangerous for you, so that you don't take it at all. So this is a list of some of those very dangerous drugs. Cannabis is one of them. Anybody knows what cannabis is?
Sorry, I sent it late.
Cannabis is the marijuana. You know marijuana? Oro de njaga. We know very well that some of you out there in the communities, in the schools, are persuaded to use some of these, not knowing that they are very dangerous. People will tell you out of myth that cannabis will do this, Enjaga will do this for you. You read better. But that's wrong. Those are myths. Cannabis is a very dangerous drug. You are better off not trying it at all because it will give a lot of side effects. There is alcohol, which you know very well. There is cat, Mairunji. We're glad the commissioner for these substances is here. She will tell you we've been struggling to get cat outlawed in the country. I think to some extent we succeeded because it's very dangerous. That Mairunji, which people chew, will cause you a lot of trouble. Heroin, cocaine are those very hard drugs, very dangerous. They are not from here, they are imported, not even imported, but they are trafficked into the country and people use them and they get a lot of challenges. Tobacco too is bad, lot of effects, and I'm glad Uganda has gone a long way in fighting this tobacco and the other ways of taking it, and I think we've made some headway. There are also drugs which we use in hospitals for genuine reasons, like ensuring there's no pain for people, but some people get addicted to them and use. Others use sleeping pills, like the Valiums and so on, for various reasons, but which is not good. So next. Those are just showing you the type. Let's go to the effects. Yeah, the effects of the drugs now. The effects are many. We tend to classify them. There are those that cause the social effects. There are those that cause economic effects. The social is mainly, we see a lot of violence. You've seen domestic violence in homes by people that are using alcohol and drugs. You've seen divorce. We've seen some people, young people running out of their homes. They get to the streets because the parents are using a lot of alcohol, they are using drugs, they are fighting all the time. So all those are effects that result from people using those various drugs. But there are also back. I wanted them to see the other challenges. Back, up. Yeah. And up. Yeah. I also wanted you to know that you can drop out of school. It's a very, very common effect that we see, that young people, they have reached a certain stage, they have joined S6, they are in S5, they are joining university, but because of use of alcohol and drugs, they fail to continue because they develop various other problems. So drugs can make you drop out of school. They can make you drop out of job. They can make you commit crime, end up in prison. So all those are social problems. Then there are the health issues. The health effects are also many, very, very many. But that list is just a drop in the ocean. The effects are so many. Almost every part of your body that you think about will, at the end of the day, get affected if you use any of these substances, be it alcohol, be it tobacco, be it marijuana, be it whatever, okay? And the effects occur in two ways. There are those that will come soon after you've taken the drug, even when you are a learner, even when you are taking them for the first time, okay? You can get into accidents, you can get into various forms of confusion or whatever. Those we call the early acute effects. But then after prolonged use, then this list you can get the cancers, high blood pressure, diabetes, HIV. Does anybody know how you get HIV because of using drugs? Yes, good. I'm happy to hear that, Hepatitis, infertility, and so on and so forth. But besides that, there are also those mental health effects that I talked about. You can get depressed. You can get depression because you have been using a lot of drugs or a lot of alcohol. And the depression goes with what? What follows severe depression? Anybody knows? Suicide, yes. You lose hope, you You are feeling sad, you are feeling what, and at the end of the day, you are just trying to kill yourself. And some have succeeded. Then, of course, the other effects is the anxiety. You can get dementia. When you get dementia, you can't read, you can't study, because the memory is so bad, affected by alcohol and drugs. Sometimes you also get acutely mentally sick. I know my time is up. We shall probably see you when you ask questions. We shall follow that up. But as I conclude, I just want to remind you that drugs affect your bodies, they affect your mind, they affect your studies. So you are safer off keeping yourself away from them. Give them a distance. Don't get anywhere near. But the key purpose for this meeting is for us to raise awareness. So as student leaders, get this information, but remember to pass it on to your friends when you go back to school, so that we know when you are here, if we have like 300 of you, and each of you, you go back to school, you reach another 300, what number shall we have reached? Okay, big number. Then you also tell those to keep, transmitting the message, so that at the end of the day, like the purpose for the International Day Against Drug Abuse is to create awareness so that we can have a drug-free world. Thank you so much for listening to me.